The topic for discussion is related to a DM spotter or DNB nephrology spotter, where students are getting confused once they are seeing this kind of images. Because as a resident during your 3 years, most likely you might have encountered the 3D VR images of the CT. But few students might not have seen, they might have seen only the axial and the coronal and the sagittal section of the CTs. In the exam, all of a sudden, examiner might come up with spotter in the form of CT images only, but those are 3D reconstructed VR images as shown in the either in the background or now you might be seeing in the display. This is a CT, non-contrast CT image showing bilateral DG stent. In the two-dimensional image, we will see only the stent. For comparison, I will keep a DG stent simultaneously in the two-dimensional image. If it is not appearing, you can look in the short in this channel. Multiple shots, YouTube shots are there where you can see the DG stent in the typical CT sections, axial and the sagittal section or coronal sections. That is a two-dimensional image, whereas this one is a 3D reconstruction where you can actually see what is the position compared to the anterior and posterior relation, compared to the medial and laterality can be better located. Few centers, or if we specifically ask the radiologist to give these images, they will give. It is available for both contrast and non-contrast CTs, where a better appreciation of the clinical scenario can be made. Since DNB students are DM residents, many times they get confused even in your intra-institute exam. If you see this, sometimes they will get all of a sudden, what is this? Few students guessed this as a PET scan, PET. Why? Because they thought it is a different kind of modality than CT. No, it is CT only. Sometimes you might get 3D of MRI also, but as far as I know, most likely we will get CT 3D VR images, NCCT KUB. So this is an image which is showing CT, computerized tomography image, 3D VR reconstruction, where you can see the anterior posterior appreciation better. In the real time 3D any structure, here you are seeing the DG stent is better seen. Initially I thought of uploading it as a short, but I don't want some random person to go through these kind of images which they might not be comfortable. It is particularly for students who are appearing for the exam, nothing else. So that is why from the short I converted into a video, so that whoever wants only click and see this. That's all. Bye bye. In the next video we'll see regarding another topic.